Hey everybody, welcome to my channel. I'm Dr. P, a board certified OBGYN. And today we're talking about, can PCOS cause chemical pregnancies? In this video, you'll be sure to understand exactly what a chemical pregnancy is. We'll review PCOS and what that presentation may look like. We'll talk about early pregnancy loss in those with PCOS. And we'll talk about what the current research shows as far as PCOS and early pregnancy loss. So for our talk today, let's first dive into what is PCOS and what that looks like for the average person. PCOS is an acronym that stands for Polycystic Ovarian Syndrome. Now, Polycystic Ovarian Syndrome, if you were to break down the roots of these words, poly means a lot, cystic means like round bubbles. I like to think of them as they're round collections that can house different things such as water, blood, a follicle, or an egg that's preparing for maturation. They are enclosed in a cyst. Ovaries are one of the two structures that houses all of our follicles and our eggs that we were born with. And so with that, polycystic ovarian syndrome is a condition where you may have symptoms that have to do with one of several different things. Symptoms having to do with insulin resistance, issues with weight gain or weight loss. We may have problems with hair growth, hair loss. We may have issues with acne and the way that our skin feels, like too dry or not moisturized enough, just feels very brittle. We may have issues with our mood, anxiety, depression. We can have so many issues linked with PCOS. But what we do know is that it is a hormonal condition. It is a hormonal problem. And so with that, you may have more commonly anovulation, meaning that your cycles are not occurring regularly every 21 to 35 days. You may go very long periods without one. I've had patients tell me they've gone years without a menstrual cycle and they're not menopausal, they're not prepubertal. They should get regular cycles, but they do not. It also means that you may have high androgens. That is a medical term. That means that you have higher male hormones in your system than you ought to. Now, when we think about our female reproductive hormones or sex hormones, we think of our estrogens, progesterone, and in a small amount, testosterone. In those with PCOS, we may have much more testosterone and other male androgens than a normal female would. Lastly, as far as a diagnosis standpoint, you may have polycystic ovaries. And I say may because not everyone with PCOS has polycystic ovaries. This means that in your ovaries on ultrasound, we may see lots of developing follicles with eggs and not enough matured eggs. And so your ovaries may be filled with all these cysts that have immature eggs within them. And so the diagnosis of PCOS comes with having two out of those three things. Now, let's turn the page a bit and let's talk about chemical pregnancies. A chemical pregnancy is a pregnancy that began but does not continue. Oftentimes, this pregnancy will stop or end within a couple of hours or days after fertilization. So what happens when we think about this is we have an egg, we have a sperm, they come together. That is called conception. The two become one and then continue the process of traveling from the fallopian tubes to the uterus and at the same time multiplying from just being 2 cells to 4, and then 4 becomes 16 and 16 just continues until we get to the uterus, wherein a pregnancy becomes well established. With that, we'll start to see an embryo growing and have a heartbeat and the whole works. A chemical pregnancy occurs and ends within a couple of days of pregnancy starting or fertilization beginning. And so for the person who is pregnant, you may not know that you're pregnant. You may not know that the pregnancy has stopped. And the reason is it stops so early along the process that you didn't feel pregnant. Some people may have missed their cycle, but only by a day or two. And then bleeding comes and you think that your period was just late that month. And so it happens so quickly that it wasn't enough time for your body to actually show that it is pregnant or feel like it's pregnant. That is what we consider to be a chemical pregnancy. Oftentimes with this kind of pregnancy, we are only aware that it's truly happening by doing a blood test. Blood tests for HCG, which is a pregnancy hormone, is much more accurate than a urine test. And the pregnancy stops so earlier on that if you had not missed your cycle, you would have not done a urine test anyway to check for it. And so chemical pregnancies are common. They happen all the time, but most people are unaware that they're happening. So now let's bring the two together, PCOS and chemical pregnancies. Early pregnancy loss, like chemical pregnancies, will occur in women with PCOS at a rate of about 30 to 50% of the time, compared to those who don't have PCOS, where we may see chemical pregnancies in 10 to 15% of those pregnancies. We also know that women with PCOS have up to 53% more odds of having a miscarriage compared to someone without PCOS. So why do women with PCOS have more of a problem with pregnancies and chemical pregnancies than someone without it? A part of our thinking here or theories, I would say, as we're still trying to figure this out, is that a lot of women, and by a lot, really about 70% of women with PCOS deal with insulin resistance. The problem with this is that insulin resistance does not mean that your body doesn't make insulin. It means that your body does not respond and use the insulin that it produces well. And so the insulin comes from your pancreas. When your pancreas detects that you have a lot of sugar or carbohydrates in your blood, it then says, oh, okay, you need insulin. Let me release insulin into your system. And so it will release insulin and your sugar levels will still remain high in your blood. And your pancreas says, well, clearly we need more insulin, and it pumps out more insulin. And so then when you take a look in your blood, the sugar levels are still the same. And your pancreas then tries even harder to make more insulin because it thinks that there isn't enough to get your organs in a place where it will use the sugars in your system. And so insulin resistance is just that problem. There's insulin present, but your organs cannot and will not respond to them. Over time, this may affect what's happening in your pelvis. This affects what happens with an egg and sperm that has come together, fertilization has begun, and the process of journeying to the uterus and establishing as a well-placed pregnancy. All of these changes are impacted by insulinemia, which means high insulin in your blood, as well as high sugars in your blood as well. And so it's very difficult for the pregnancy to establish itself well inside of your uterus under these conditions. We also know that if you have PCOS with high androgens, which is also called androgenemia, we also know that your eggs may not ovulate appropriately. They may not have matured well, and they don't have the components that would be normal for a developing pregnancy because of the lack of or having too much testosterone in your system. This means that the embryo quality, once egg and sperm meets together, might not be very high. It might be very poor, but it also means that this embryo will have a difficult time implanting itself inside of the uterus to establish the pregnancy. We also know that people with PCOS have a higher degree of inflammation throughout their system. Inflammation, if you can imagine, is not a good and healthy state of being. And so it makes the environment for a pregnancy to develop much more harsh. And so if we can control the PCOS, if we can balance our hormones, if we can make changes that will make your internal pelvic system function much better, we can decrease the likelihood of having recurrent or any type of pregnancy loss. So how do we do this? We want to make changes. We want to change the way we act, the way we live, the way we are. And the way we do that is by changing our lifestyle, eating well. It means resting. It means decreasing stress. It means that we understand how things around us impact our hormone levels, like the foods we eat, yes, but the things that we put on our skin and the things that we're breathing in, because these things can be hormone disruptors, and we want to remove them so that your system can function at its best. And if you need help with this process, I am more than happy to send you a free copy of my ebook, Hormones Don't Lie. In this ebook, I will dive into the changes that you can make to help balance your hormones so you can decrease the risks associated with PCOS and increase the likelihood that your fertility will be strong and your body will be well. If you'd like a copy of this ebook, check the link below this video and I will happily send it over to you. And if you have questions, please drop in more comments. I'm ready to read and see them all. Thank you so much for listening in today. Thank you for your support of our channel. I'm Dr. P. I'll see you again soon.